Is it full screen, sir?
No, not yet. It was full screen. I think somehow it came back. Yeah, now it is full screen. Yes. Keep it there, no problem. Okay.
One second.
No, now again it has come back to normal.
Yes, sir. I'll just do it. Multiple, this thing is open, so I'm just
No
closing.
problem. So we are live on YouTube. Please make it full screen and keep it there. Dr. Pravallika, please make it full screen. We are live on YouTube already.
Yes, sir.
All right, good morning, Maria, Shah, Snehita, Akhil. Thank you for joining in. Please confirm if you can hear me. We are on live on YouTube. The recording will be made available to you soon after the session. Yeah, all of you who are joining from YouTube, you already have the access to the replay. Yes, am I audible? And also, can you see the screen? Please confirm. You can just put in the chat box if you can hear me.
Sir, it's a little bit slow. Let them put their questions or anything by the time in the WhatsApp, what they want to know during the session.
Yeah, no problem. They can do that. So I'm just asking those present on Zoom, can you hear us? And also on YouTube, if you are able to live on YouTube, please let us know if you can hear us on YouTube. Just type yes in the chat box so that we know that everything is working fine. We'll go live in just maybe another 1 or 2 minutes from now. So meantime, we're just doing the backend check, ensuring everything is working fine. Please confirm if you can hear us. Yes. All right. Thank you so much for confirming. Dr. Pravallika, could you make the screen full screen? Keep it full screen there.
Actually, not. Sir, once I want to leave the meeting and come back, I think that would be easy for me.
Yeah, no problem. You can do that. All right. So we'll go live in some time. Thank you, Snehita, right? Snehita and Akhil, Mary for joining in. Please put in which year you are studying. PharmD, which year in the chat box. And all of you who are watching us on YouTube, let us know which year you are studying. Are you able to hear us? Yes, no. Third year PharmD, perfect. Perfect, thank you. All right, meantime, you can also share this link on your WhatsApp groups to invite other PharmDs to join this session. I'm sure this session will be very, very interesting for some of you interested in learning oncology. On YouTube, please confirm if you can hear us. If you want to interact, please be part of the Zoom session. If you just want to learn from the replay, you can be on YouTube, no problem. So those of you on YouTube, if you want to come back on Zoom, you can join Zoom. Let's make this a very interactive session. I'm just waiting for the expert speaker, Dr. Pravallika, to be part of the session. She is facing a little bit of internet connection issue. She should be able to join soon. So those of you on YouTube, are you able to hear us? Hear me clearly? Confirm yes or no on the chat box. If you want to join YouTube, join there. If you want to join Zoom, please join. We are just doing some back-end work. We'll be able to go live very, very soon. Dr. Pravallika, you can unmute yourself and talk. Please share the screen.
Yes, sir.
Perfect. And all the PharmDs who have joined us, please invite your other friends also. Let's try to learn together. This will be a very interesting learning session for all of you. You can ask all your doubts today with respect to oncology during the session and after the session with Dr. Pravallika.
Now people are asking for links, sir.
Yeah, there was some mismatch.
Sir, is it full screen?
Not yet. Yeah, now it is full screen. Yes. All right. So we'll do one thing. We'll go live and we'll share the recording with all of them who are asking link just in case they're not able to join
Sure,
us.
sir.
And we'll do a Q&A session maybe later on if needed again to answer their queries. But let's get started now. All right. So good morning, everyone. Thank you for joining in today. Today is a very special day. We wanted to help you understand the role of oncology pharmacists. And we have with us the expert pharmacist, Dr. Pravallika. She is a trained oncology pharmacist, and she wants to share some learning curve to you and discuss about oncology. And you can ask all your doubts during the session. So stay connected, keep learning. Dr. Pravallika, if you're there, please switch on your video and also you can start the session. On the go, you can introduce about yourself, what you did, how you did, and all of that as a story and help the participants understand more about oncology. And why did we plan to start this particular session? Because a lot of queries were coming in to understand oncology. We collected some questions from participants, and based on that, we have created this presentation. Uh, we hope that this session is interesting. So thank you so much for joining. Let's get started. Yes, Dr. Pravallika, you may take over the session from here. I'll be at the back end taking care of the participants' queries and compiling them together for you so that we can answer them when we complete the session. Is that okay?
Okay, sir. Thank you for the invitation and a fine good morning to one and all. Today here we are after so many queries in LinkedIn through WhatsApp messages and through different places and through phone calls asking me, ma'am, what is all about oncology pharmacist? Why do we need training? How do we get trained? Where are the resources? We're all about, we are going to learn oncology. How is it possible? Do every one of us need to join fellowships, residencies? What are we going to do in a residency program? What we are going to do in a fellowship program? What we are going to do in a hospital as a clinical pharmacist? Few of them tell, ma'am, we learn chemotherapy mixing. We do chemotherapy, preparing dosage calculations. How is that treatment differs from oncology care and other specialties? How unique is oncology and how unique you will be as a practicing oncology pharmacist? Everybody have same doubt, but the question asked in different ways. So it's all to enhance treatment outcomes and patient support. So that's what you can see there. This is all because why you have to enhance treatment outcome, because cancer is very complex and patient support. It's need of the hour. And the health support systems are very less in treating cancer. So with all that and with all your questions, today we are here to answer all your questions, all related to oncology clinical pharmacy. Please do join and please share with your friends the link. And anyone who is not able to access through YouTube, you can just type on your questions and here also and later. Okay, let's not make it too late. Let us join and let us start.
Absolutely.
So in today's before we start to explore, the roles and responsibilities of a clinical pharmacist. Okay, let's take a quick poll, to understand. How much are you familiar with the roles and responsibilities of a clinical pharmacist? Like very familiar, somewhat familiar, not familiar, but interested to learn and not familiar at all. You can type in the chat box.
Put in the chat box ABCD. Let's see how many of you respond to us. Not familiar, but interested to learn. So majority of them are putting C as the option. What about rest of you?
Please be interactive and make the session more interactive to get answer for your queries.
Absolutely.
Rather than a learning session, make an interactive session to get your doubts clarified.
Absolutely.
Okay. Whether you're already familiar with or eager to learn more, or we have got you covered here. And clinical pharmacist as a part of a healthcare team plays a crucial role in ensuring safe, effective, and personalized medication therapy through the conduct of medication reviews, optimization of treatment plans, and educating patients on proper use to enhance patient outcomes. Okay. Here are so many multifaceted roles and responsibilities of a clinical pharmacist, which will have impact on patient care and play a pivotal role in promoting medication safety and wellness. Okay. Before we go, see, we have so many roles and responsibilities as a clinical pharmacist. What is that? Something called as patient consultation. What is this patient consultation? It is nothing but a consultation by a pharmacist, which is a cornerstone for patient-centered care to promote medication safety and adherence to provide personalized guidance to the patients. How are you going to do that? Through medication history interviews. And you have something called as interdisciplinary rounds. What is this interdisciplinary rounds mean? Interdisciplinary rounds is focus on this holistic patient care. What is this holistic patient care and how does it focus? So interdisciplinary rounds have, people from interdisciplines like nurses, social workers, pharmacists, where, discuss for a patient's care plan and then tailor the treatments. And there is something called as medication therapy management. What is this medication therapy management? Medication therapy management includes treatment chart review and multiple things which are related to the medications, which combine all that and incorporate all the aspects related to medications to tailor a patient's treatment plan. And treatment chart review. Why do you do treatment chart review? Treatment chart review contains all the information regarding the treatment of the patients from the history till the ongoing treatments, prescribed treatments, past treatments, everything. So why do you need to treatment chart review? This is the place where pharmacists place an expertise where we have the drugs written in the chart. So you need to review the treatments for drug interactions, everything, drug interactions. Is there any, dosage adjustments, whether the brand is written correctly or not, prescription audits for adverse drug reactions, everything. Treatment chart review is like a place where you can get one through all the information of all the interdisciplinary team members, what all are they doing for the outcome of the patient. And medication administration is not the prescription, it ends. The correct treatment or the best treatment for the patient will not end up in prescription, but you need to administer it properly and also monitor outcomes. And for drug information resources, pharmacists act as a drug information resource in the hospital setting or the healthcare team. When someone needs some information regarding the drug, you know how to search through different websites or through different authentic resources to provide the medication information to the patients, healthcare team, and nurses, everyone, even to the public. Why I'm telling you the drug information resources. It is not that everybody can read it from Google, but the information that is provided by the pharmacist is authentic and referenced information. So that is why you are different in answering a drug information query. And patient education is a very much important thing in today's healthcare system, because there's so many medications with so many different brands and so many biosimilar drugs of the same parent drug that are being synthesized. And clinical trials, you don't get to see so much of information, and you will see everything in the post-marketing surveillance or after the prescription of the drug into the market, where you could get to see the unique adverse effects of the drugs. And you need to educate patient on the use of the drug. For example, when you tell some patient to take a drug, doctor prescribes your drug and write like 101. Somebody tells you Belage Madhyana Ratri, Paddana Madhyanam Saintram. Something they tell in different languages, but it means the same. But will you take it when I tell you just take this pill, take this pill, take this pill? Nobody is ready to take. But when you tell them, see, you are prescribed with, you have come with so and so complaints, you are being prescribed with so and so medication, and during the process you have been advised for so and so test, and you need to do this test to understand how this medication is working on you. You need to follow up for this, and you can explain the patient every medication why it is prescribed for, and correlate with all the symptoms patient has arrived to the hospitals, so his medication adherence will improve. Only the medication adherence with proper understanding and good medication compliance also will give a good outcome of the disease or symptoms. When patient is not educated on his medication, he will not take it. Antimicrobial stewardship. Now it's become a very important role in the hospitals, and pharmacists are playing a major role in antimicrobial stewardship programs in checking out the drug utilization of antibiotics specific to the hospitals, and also, comparing the cost of antibiotics. There are different brands of antibiotics which are expensive and need to be administered to most of the patients in the emergency care settings. And um, microbial drugs, antimicrobial drugs are administered from a range of 3 to 5 days to 7 days. And all the IV antibiotics are administered in the hospitals. And you need to see so many things related to antimicrobial stewardship. And doctors or physicians or other healthcare professionals do not have so much time to spend on stewardship because they're busy with the patient consultations. So pharmacist is playing an important role under the guidance of physicians and as a part of healthcare teams in many of the hospitals. And see, drug utilization evaluation is a part of ongoing process in most of the hospitals. For updation of your treatment plans and also correction of your medication errors, and also to improve the quality care of the patients through the results of this drug utilization evaluation services. And inventory control plays a very important role because different hospitals in different settings, the drugs are stored in different places. And storage of drugs is one of the primary labeled indication that everybody should follow. And different medications of different categories should be stored in a different way. And that should be taken care of in the wards. That can be taken care by the pharmacists who are in the clinical settings and in the hospital. And clinical research. Because of ongoing research in multiple various departments, whether it may be gastroenterology, whether it may be oncology, in many specialty areas, clinical research is going on. And many drugs are being new drugs are being administered to patients in wards. And pharmacists play a very important role in clinical research and participating in ongoing clinical trials. And quality improvement initiatives. So how do you do this? You have so many quality improvement programs based on the research studies or small studies that are being conducted in that specific to the hospitals, or also from the national guidelines that have been updated time to time. So by incorporating those tailored to your own institutions, you can play a role in implementing quality improvement initiatives. So next, so something you are waiting for. So you have checked the roles and responsibilities, and now you may ask me, ma'am, why is it importance of specialization in pharmacy practice area? Irrespective of oncology, whether any specialization, why do you need to specialize? So that is very much important, right? To upgrade knowledge and skills with intensive training. So it allows you to focus on a specific area of pharmacy practice, becoming an expert in that field. Suppose if you are interested in some gastroenterology, so to practice in the area of gastroenterology, you need to work in gastroenterology, or you need to specialize with all the pathophysiology, mechanisms, drugs, everything, the diagnostics, everything related to gastroenterology. So you can upgrade your skills in that area, and you have a proper intensive training with all the trained physicians and under the physicians to understand how the treatment patterns, how the patients progress with different diseases that are related to your gastrointestinal system or cardiovascular system, or any specialized area. And for patient care, and you can see something like competitive edge for jobs. So you can see now so many companies are doing trials in specific area of cardiovascular drugs, oncology related, and everything. And if you have a knowledge in that specialized area, you can go and join you will be a preferred candidate for that job in that specialized area of that industrial research, wherein which you will be stand out for that job when you compare with other people. So it will be like in case of medical writing, for anything, if you're specialized in that area, people would prefer you rather than others. And to gain expertise. So gaining an expertise make you a pharmacist specialist in that area. When you want to become a generalized clinical pharmacist, you will be stepping on multiple boards, and you will not be able to focus on one thing. You have to read so much, and you will not be understanding in which area you want to upgrade your knowledge, where you want to upgrade your skills. And you will be interested in few cases. Maybe somebody will be interested in neurology, somebody will be interested in antimicrobial stewardship. Uh, so you will not be able to focus on multiple things, but rather you will be ended up in doing some NABH aspects of the hospital, and also, some quality work and quality related work of the hospital, but you will not be actually going into the patient care. And you see patient care excellence. When you are like specialty focused, you can focus more on your patients, drugs, lifestyle in all the aspects of patient care, and also providing drug information services to the physicians or the healthcare professionals, conducting community screening programs, diagnostic programs. You can participate in community activities. You can be a role in that specialized area, practice that area, and you can improve the health of the patients, better improve the quality of care related to the use of the drugs and everything pertinent to that disciplines. And career advancement. So it will open the doors to advanced career opportunities, leadership roles, and also it will have a job satisfaction. So that is career advancement. And evidence-based practices. Uh, and evaluation of evidence-based practices will help you to practice with upgradation of knowledge. Since you are sticking to a specialized pharmacy practice area, you will be upgrading on all the evidence-based practices, like through reading research articles, publications that improved and changed guidelines from time to time. And you will update yourself on the use of the drugs, adverse effects of the drugs, and also like how to the newer diagnostic techniques that have been incorporated into the treatment or therapies, the newer approaches to treatment, and how it is varying with different epidemiological states. So many things you will be able to focus on a specialized area of practice. And quality assurance. Since you are specialized in that pharmacy practice area, the information you are providing will have a quality. And also improved quality because you are giving all the information from the guidelines or referenced text, everything like that. So there'll be quality assurance. Somebody can assure this pharmacist is like you can trust him for this area of practice. So you will have your own unique identity in that specialty area to practice, and it will give you so much of job satisfaction and unique experiences in that area. So you would ask me, ma'am, why oncology? Why don't we go for cardiovascular system? Why don't we go for, emergency medicine? And you see some fellowships are there for emergency medicine. But why are you telling why oncology? Why today's session is in oncology? What is the difference that makes with oncology and other specialties? So before we understand why oncology, let's see this. So it's like recently published in 2022, like burden of cancers in India, estimates of cancer crude incidence, all this. You can open this paper. I'll open this link for you. So you can see here, burden of cancers in India, estimates of cancer crude in. Sir, is it visible?
No, Dr. Pravallika, your main PowerPoint screen is visible, so you can reshare that. You can click on the new share and then share that screen as well. Otherwise, we'll do one thing. We'll explain the PowerPoint first and then we'll share the links later on with them.
Yes, sir.
That will be better.
Sir, is it fine?
Yeah, it's fine. Perfectly fine.
You can see this, the links will be shared in the group. You can check out this article wherein which you can see the burden of cancers in India and also like how this National Cancer Registry program have been initiated. And so see another article, which has comprehensive value-based cancer care in India, opportunities for system strengthening, health system strengthening. You can see here, there is something called as this Ayushman Bharat scheme. As you have known that cancer treatments are very expensive and it's not reachable to the all sections of the people or society. And recently the Ayushman Bharat scheme, which have been initiated from the government of India, have included, you can see here, it have included control of cardiovascular disease, diabetes, cancer, and stroke. And also it has been integrated into this scheme. So the opportunities for patients to take treatments under this scheme have increased. And also these governments have taken actionable strategies for comprehensive value-based care. What is this value-based care? Value-based care is nothing but wherein which you deliver therapy to the patients with integration of multiple departments, interdisciplinary and multidisciplinary systems. And government, through these strategies, see, for example, you can highlight it here, define and deliver individualized therapeutic strategies based on patient participation and shared decision making. What is this shared decision making? So it is taking the opinions from all the interdisciplinary teams. So even you can see how government is encouraging for the comprehensive value-based care to the patients for better quality of care and outcomes. And it is also helping provide them with financial support to take treatments. And you can see different state governments have different healthcare schemes wherein which the patients can get treated for their conditions. And you can see one more paper which is published in India itself, like state of cancer in India and opportunities for innovation. You can see here, these facts, these studies have also highlighted a shortage of chemotherapy pharmacists and chemotherapy administering physicians, which could potentially compromise the delivery of high quality cancer treatments. The factors added to the clinical duties of medical oncologists and limit opportunities to partake in clinical research. In fact, work time is allocated. You can see because of these factors, there's less medical oncologists when to treat patients. Almost for around 2,000 patients, there is only one medical oncologist. the ratio. It's comparatively, 100 times less than that of US. And they have limited opportunities, to participate in clinical research because they are completely busy with the patients. And they don't have enough people to take part in or to do chemotherapy pharmacist. You can see this paper, you can see that there's need of the hour. People need pharmacists in oncology settings. So the links will be shared. You can just read through the article and you see. And one of the strategies is leverage technology and invest in building infrastructure and workforce. What is it workforce? Is nothing but investing in building healthcare infrastructure and workforce for cancer care in India is essential to improve patient access to quality care. So workforce also include pharmacists. So they're underway at the national and state level. So your opportunities are going to come in both central and state levels. See, that is what I'm telling. Whether this person can be a physician, pharmacist, or nurse. The patient load is increasing and you have seen the increasing number of cancer cases and cancer burden in India. So when the cancer burden increases, the pressure, the amount of work will increase for physicians, pharmacists, nursing, everyone. So to give a better quality of care and also standard of care to the patients, you need to improve and also have lot of trained workforce in that specialty departments to deal with the conditions that arise in that specialty areas. So there is incorporation of multidisciplinary team approach in cancer care. So what is this multidisciplinary approach? You will be having the doubt between interdisciplinary approach and multidisciplinary approach. Multidisciplinary approach will focus on the specific treatment modalities or intervention within the individual specialties. Suppose a team of oncologists, surgeons, radiologists, and pharmacists, they all meet together in a tumor board to discuss the best approach for a cancer patient's treatment, focusing on treatment protocols and also medication adjustment. And in interdisciplinary is like you get people like social workers, nurses, pharmacists, all these people which will discuss patient's treatment plan, and also they consider the medical needs, social support, and also medication optimization for the patients. And there's something called as patient-centered approach, wherein which all these people come to the patient to provide better quality of care instead of patient going to different places. So why oncology? So how does it make difference? So why specialty training in oncology? What are you going to learn? Normal clinical pharmacist and oncology clinical pharmacist. And before, why you need specialty training? When a person takes paracetamol, it not be much dangerous when you consume it in a larger quantity. It is dangerous, but it is not as such dangerous as you take, all antidepressants and narrow therapeutic index drugs. So all the anti-cancer drugs are narrow therapeutic index drugs. So even a small change in dose of these drugs will lead to adverse effects, severe adverse effect and anaphylactic reactions. So these drugs need to be carefully monitored by understanding the pathophysiology, pharmacology of the drugs. So you need to have a specialized knowledge and also advanced knowledge in monitoring and managing these drugs, and complexity of treatments. And the treatment complexity varies in oncology. It includes treatments of surgery, radiation, targeted therapy, immunotherapy, chemotherapy, combination of radiation with chemotherapy, with immunotherapy, targeted therapy. When they combine different modalities of treatment, you should understand the severity of adverse effects that are related to each treatment and also the combination of treatments combined together. And for that, you need to get specialized in that area to understand the different aspects of adverse effects, complexity, the level, everything, and how to manage. And evolving therapies. And you can see immunotherapy, targeted therapy, etc. are evolving. It's the current trend. The treatment of cancer is changing from traditional chemotherapy to targeted therapy, immunotherapy, recently upcoming CAR T cell therapy, everything. And it's also personalized treatments are being given to patients. And the future of oncology is completely personalized treatments and promotion of drug safety. Drug safety is very much important because so much of adverse effects are there. How to tailor patients' medication regimens with respect to the ongoing treatments and other treatments by performing medication reconciliation with the patient, and also keeping in mind the different types of cancers the patients are being treated with, and also focusing on the adverse effects that can occur, have already occurred, and the patient is at risk. And safe handling, preparation, and administration of treatment. So you should, since the narrow therapeutic index drugs and also, very toxic drugs, how to handle them. It's not the people who is taking, if you're getting exposed to the drugs in terms of, touching it, you should know how to handle the drugs. When anti-cancer drug taken inside or given systemically, how effective it is, it will also have effects when it is not handled properly because you're exposed to the drug. And preparation of the drugs, all they're very concentrated and they cannot be given direct IV. They have to be mixed with different diluents, and you have to check for different compatibilities of the drugs with different solutions or different diluents, and you have to administer to the patient. And you have to tailor based on patient needs, whether the patient is renally compromised or, whether the patient is compromised with his liver or with his blood counts. Everything you will have to check before the preparation of the drug, whether based on body weight, based on body surface area, depending on the AUC of the drug characteristics and patient characteristics have to be monitored before you prepare the drugs. So you will be learning all that. And personalized treatment, when you have to give chemotherapy along with targeted therapies. And these targeted therapies are mainly when you administer monoclonal antibodies. These are synthesized from the human and humanized, and also from different maps from rats and all these things. So that you have more chance of hypersensitivity reactions, and you need specialized practice and also skills to administer these monoclonal antibodies are targeted therapies because patients are more prone to hypersensitivity reaction. So just think, how can you do it without understanding the pharmacology and basics of the drug characteristic? And you should even understand when a new and you see you don't have much clinical trial data to support this. How do you to handle these treatments in wards, and how you should play an important role as a part of a healthcare team in monitoring and managing treatments to patients and also administration of drugs in the wards. So how need to tailor, how need to prepare the drug? If somebody asks you for 300 mg, are you going to give complete 300 mg of the drug to a patient? And how the rate of infusion is. Everything you need to monitor. Personalized treatments for a pharmacist in terms of preparation and administration and monitoring, but rather than diagnosis. You can even help prescription of diagnosis of various tests to patients. You can even explain them on all that based on the updated guidelines. And complexity of adverse effects. Complexity of adverse effects. You can tell, when you go and see a medication chart review, as a pharmacist, you will be able to tell. So patient was administered with so and so drug and patient has this adverse effects. And the same patient with breast cancer will be administered with the same drug, but the severity of adverse effects is less. So in some cases, there is prescribed with some drug for the adverse effect or the what you call a side effect, but there is no drug for the same adverse effect prescribed to the patient. There is something called as grading of these adverse effects, when to prescribe treatment. So why did this person experience certain kind of adverse effects? Why the same patient did not experience? Does he have radiation in his protocol? Does he have this? So you need to understand the adverse effect. It's not just by just checking out, okay, patient experienced 3 times vomiting. Okay, patient experienced vomiting. No, that is not what you do. That is not what something called a specialty training or improving quality of care. So you should understand the insights and intakes of the prevention of adverse effects, what you do and ongoing, and what you should do after a treatment. What can be the patient at risk of? For example, when you see a patient from cycle 1 to cycle 2, you can see the decrease in blood counts, but there is no significant decrease. When you tell it is significant decrease, it should be lower than the normal lower limit of the normal range value. But when you see the trend to decrease, you can suspect what the patient is going to have in next cycle and you can prevent them. So all these critics and all these things you will be learning when when you have a specialty training in oncology, you will be able to provide better care to the patient. And patient education is so much important with oncology drugs or chemotherapy drugs or targeted therapies or everything, because these cutting edge treatments have so much of adverse effects and newer adverse effects. And to cope up with cancer, to adhere treatments with cancer and to follow ups, and also not only patient education in terms of medication use, but also the diet, and managing adverse effects, when to revert back to the hospital, and how each drug will show different adverse effects, what patient have to do, what patient caregiver have to do. So you will play a very important role in patient education during administration, before the starting of the chemotherapy, after chemotherapy, until the completion of the treatments. Through the journey of his treatment journey, you will play a very important role for every patient, and you will be recognizing patients with their name and the way you talk, how you should know. It's not just going to telling them take this medication, this is for vomiting, and when you should take, how you should counsel the patient. All that matters, your communication skills, the points you talk, the way you approach, everything you need to get specialized in that area, because there is like so much of psychological impact on patients and also patients' family who are undergoing these treatments. And supportive care. Supportive care is so much that you need to explore in oncology. The day you explore, every case is new. So for the side effects, you need to provide supportive care to the patient. There are some patients for end of life care and all this, like who are taking treatments to have a better quality of life rather than for the curative intent. So you have different types of curative intent, curation, palliation, everything. Even during the curative intent, you need to provide supportive care to the patients in managing their adverse effects. So you need specialty training in oncology to perform all these activities in the wards. And don't ask me, ma'am, drug interactions, dosage calculation. These all are the activities of a clinical pharmacist. These are why you should get specialized. Even you should get specialized. These are addition to what I have explained you as a general role of clinical pharmacist. All that you will be doing in oncology. And you should even know how to make the storage aspects of drugs are very important, because these drugs are very expensive, and also if not stored in a proper temperature and condition, the drug may not work, or the activity of the drugs may change, and also there is chance of spoilage of the drug, and also hypersensitivity reactions and severe reactions to the patients. So there will be loss of money, loss of time, everything will be there. So everything need to be under vigilance in oncology. And it's a very critical care area and need of the R area of practice. So, and evidence-based practices. All the treatments prescribed are from the standard guidelines. So you need to understand how these guidelines work. How do you understand these guidelines? How do you understand a guideline for a patient? And how do you incorporate those guidelines? So every drug has its own, pre-medication and post-discharge medications. So which to include, for which drug to, for every oncology drug or every chemotherapy drug is not having emetogenic potential. Do you need to have a anti-emetic medication for that specific drug therapy or not? If not, why? What preventive medications to be given? What post-discharge to be given? So all these are evidence-based practice. You need to know how to look at the guidelines, how to understand the guidelines, how do you suggest the doctor. You need to give everything evidence for whatever you speak in the specialty area of practice. And clinical trials. There'll be so many ongoing clinical trials, and you can get to be part of these clinical trials, not only in terms of collection of samples, and not only in terms of therapy. You can even understand how adverse effects are happening, how to prepare new drugs, how to work with new drugs that are given in clinical trials. You'll get to see a lot of things. So at that time, what is your challenges? How you should do? How we should perform the activity? How we should monitor the patient? How we should change your role? Improve your knowledge on that specialty drug. How do you improve? You need to learn the process. For every drug you can't be taught in a class. Every concept can't be taught in a class, but you should learn the process of doing it. So that is very much important to become a specialty clinical pharmacist. So, and again, you may ask me, ma'am, where do I get job? How do I work with? There are so many clinical pharmacists, who are already working in the specialty area after farm day, and some are working after fellowships and residencies. How do your roles and responsibilities differ? And you have seen the already generalized responsibilities. And how does it differ? So you can see some hospitals, you can see Aster, Ramayam. These are private hospitals, if you ask me for, you know, the roles and responsibilities of the clinical pharmacist are very much diverse and can vary significantly depending on the type and size of the hospital setting, and are adaptable with respect to the unique demands of the hospital. You can see something, this is a private hospital. And when you go for this Usmania General Hospital, AIMS, these are all are nothing but medical college or teaching hospitals. So what do you do there? Your role can be in teaching and research. You can get actively involved in teaching pharmacy students, medical residents, and also other healthcare professionals like nursing staff. You can conduct some research projects. You can contribute in publications, all this. And clinical services, you will be able to provide specialty pharmacy services, in oncology, infectious diseases, or critical care. In such type of hospitals, you have multiple specialty areas and you will be able to provide there. And when you see formulary management, you can play a key role in formulary decision making by evaluating the new medication, also ensuring cost effective prescriptions for the patients. And when you check for a community hospitals, these are also, these are specific hospitals, these are like specialty hospital only for cancer care. And here you will have so much of oncology pharmacy services, you will be specialized in chemotherapy preparation, dosage calculation, administration, monitoring patients, providing supportive care, clinical trial supports, palliative care. You collaborate, with pain management services, symptom management, everything. And also you will change your roles and responsibilities and also upgrade your roles and responsibilities based on the specific needs and priority of this hospital settings. And when these all are like in private settings. So the limited hands-on experience that you gain in a teaching hospital or individual cancer hospital would be different from that you gain in a something like private hospitals that are specialty care hospitals. In these hospitals, you have to follow the guidelines, and also you can get to see cutting edge therapies and treatments, like high-end treatments the access to patient care and direct patient care from a pharmacist is little less when you compare with teaching hospitals and government hospitals. Here you will be having their own institutional protocols and prescribed roles and responsibilities. So likewise, your roles and responsibilities as an oncology clinical pharmacist will vary depending on the area of setup or the hospital that you are working in, and also the trust that you gain from the oncologist in supporting them to improve the quality of care to the patients. And you can see the emerging trends in oncology pharmacies, innovations in immunotherapy and targeted therapies, integration of these genomics and precision medicine into treatment approaches, new diagnostic techniques, next generation sequencing, and also, genomic sequencing, all these which have been integrated into practice. And, role of biosimilars. Biosimilars are lesser expensive drugs when compared to the parent. How to incorporate them into the formularies, and also the practice of use of biosimilars, they also improve access for patients to get treatments at a very lower price. And recently you have seen, to show you one of the initiative that even government supports this healthcare. You can see here the President of India launches India's first homegrown gene therapy for cancer, accessible and affordable CAR T cell therapy, provides a new hope for the whole of humankind. So President Draupadi Murmu. We can see here, this is praiseworthy example of academia-industry partnership, which should inspire many more efforts. And also, she said that with the knowledge base and skills of the faculty and students of IIT Bombay and other institutions, India as a whole would benefit greatly from the technological revolution. So she was happy to note that therapy being launched today is the world's most affordable CAR T cell therapy. An example of Making India initiative, a shining example of the Atmanirbhar Bharat. So you can see here how you can see the future of pharmacy or the future of healthcare is like so much of investment in cancer treatments. And the opportunities that will be provided is through your efforts, knowledge, and skills that will be proved in your specialty settings through the practice of your specialty as a pharmacist. So your efforts, your area of expertise, how you bring changes to patient care will definitely have an impact, and your work never goes waste. Whatever you do, it will be projected. So whatever you do in the area of practice with good clinical skills and come out with new outcomes that help to patient care practices will surely have an impact. And the future is oncology. So I think till now, do you have any doubts?
All right, participants, if you have any doubt, you can ask in the chat box. We'll take a little bit of break and then continue the session. If you have any questions, let's have that Q&A.
Please post it in the chat box.
Absolutely, yeah. Just put D in the chat box. Let's see if you have a doubt, or Q in the chat box if you have a question in the mind. Yeah. D or Q you can put in the chat box. Let's see if you have any questions or doubts, and then we'll continue. 10 seconds for all of you to put D or Q in the chat box. If there are no questions, type NQ or ND, no doubts. All right, so Dr. Pravallika, there is one question from
So that can be taken up in the last.
All right, perfect.
What I have doubt, if they have any doubts, they can post.
Okay, any doubts, you can put ND. Okay, no doubts. What is the scope? We'll discuss about the scope very soon. Yeah.
Okay, sir. Now I think we can continue.
Yeah, let's
You can
continue.
see in other platforms also if anybody have any doubts.
Yeah, I'm just checking there. In case any questions comes up, I'll compile and share with you. Okay.
Yes, sir.
All right, please continue. Let's quickly go ahead.
So guys, I think you will be understand now. You will be asking, ma'am, you told specialty in oncology is very good, and all this is fine. But how do we go ahead? How do we transform ourselves, into a specialty pharmacist or, an oncology clinical pharmacist? So I don't know if you people have followed me on LinkedIn, would have watched me on LinkedIn, or whether you have registered through WhatsApp group or through the LinkedIn. If you would have followed me on LinkedIn, you people would have been understanding this process. If you have not followed, don't worry, here we'll go. So there's something called as residency and fellowship programs. And you can see some institution offering you residency or fellowship programs. What is the difference between residency and fellowship programs? Residency has 2 years program wherein which the first year we will be focused working as a generalized clinical pharmacist and also along with the specialty practice. And it is similar to PGY1 and PGY2 programs in foreign countries. And fellowship programs are tailored based on this Indian settings, wherein which you will be focused completely in the specialty practice, and the duration is different for the fellowship programs, and they are tailored with respect to institutions. Okay. And there's something called as the work experience path. So, already you are paying so much. Everybody will ask me, ma'am, already we are investing so much in family, paying 30 lakhs, 40 lakhs, 25 lakhs. So it's changing around 4 to 5 lakhs per annum and your expenses. So after this, again, you will have to spend money and invest in fellowship programs, and you'll be having doubts. What will be our opportunities even after doing residency or fellowship? Whether this residency or fellowship is accepted in other countries. Can we go there? You will be having so many doubts. So the work experience path is, and when you see residency or fellowship paths, it is shifting the focus of many clinical pharmacy aspirants to pursue residence. And many of them turn back because of the available opportunities and financial constraints. So this is dividing the pharmacist with residency and without residency, and it is also like, perception of privilege. Everybody don't get a privilege to go and do residency. And people are not aware how much they are going to get specialized, how much they are going to learn through these programs. It's a fast track path. And the work experience path, there are still many pharmacists, who are working in oncology even without residencies or fellowship training, but they're really doing well in their own area of practice. So getting an initial foot into this area may be challenging, but there's so many strategies, that you can get started with this. So we'll be focusing on this work experience part. You need to build your network and also need to be referable for all these things. And how this work experience path going to work for you. So, the complexity of this oncology information will scare many of you, like if you want to enter this. And it's a big barrier to getting into oncology because of this complex information. So but we all have to start somewhere and we all have to continue to learn in the process. So it's rapidly challenging, to keep up with new drugs and treatment regimens that have been evolving in cancer treatments. And you have to spend your time to meet your expectations. So in the work experience path, you can do it yourself and through curated content and facilitated learning. So like do it yourself, all the content, you see Google, everything is available on there. So the price you pay is just your sweat. Finding and organize the content in a way that you want to learn from various resources from ASCO guidelines, NCCN guidelines, National Cancer Grid, and so many other resources. And what is this something called as curated content? So it is also like do it yourself, but you have a filter here. You had someone in some way, they have curated the content from the online and they have made it in a way that you can watch, you can read in the form of articles, listen in the form of podcast, and they also have do it in some kind of post in some social platforms. So there you had someone to do it for you. And what is this facilitated learning? It means you have an expert to answer your questions. In curated content, all the content are not free because it is being curated and you need to pay for it. And in case of facilitated learning, you have in curated content, you don't have anybody to answer your questions. In the process, you will be saying, okay, this is what, but you will not have anyone to answer your questions or queries that you learn in the process. In this facilitated learning, you have an expert to answer your queries. You have learned something about dexamethasone. So you need an answer why this is given, why other corticosteroid is not given. Why don't all the regimens choose only low dose dexamethasone? So you don't know that. So this is where you need personalized support can help you in understanding in the specialty area. Okay. I think you understood it better. So there are so many oncology training programs. In India, we have seen like HCG, Ramaya, like few other colleges and institutes started developing fellowship programs. And JSS, you have a residency program, the only institute. And people, you will be having doubts, how these differ. And if in foreign countries, they will recognize your degree only if the college is ASHP accredited. And we don't have single program which is ASHP accredited for specialties in India. Only ACPE is accredited to PharmD education only in JSS, and ASHP is not accredited to the residency program in JSS or any other institute per se. And all these residency and fellowship programs will be considered as a work experience rather than a degree in other countries. So you can see the oncology is very complex. You need to understand about the progression, surgery, radiotherapy, diagnostics, health, everything you need to understand. You need to understand medicines. You need to understand about anticoagulants. You need to have base knowledge of, the drugs. You need to have the base knowledge of the diseases. You need to have the knowledge of, different things or tools that are used for administration, drip sets, needles, injections, syringes, different types of syringes, different types of formulations, different aspects of pathology, different aspects of anatomy, different aspects of so many other clinical pharmacy. And also you need to understand incorporation of pharmacoepidemiology, all the knowledge that you have acquired through your 6 years PharmD curriculum into a specialty practice in the form of application for you to become a specialty clinical pharmacist, just not a specialty clinical pharmacist, an expert clinical pharmacist in that specialty. So you need to have knowledge on all different area of practice and different subjects. So taking an initiative, understanding your queries and everything, and also an initiative to teach you oncology. And it is a part of, the work experience path and do it yourself. And many of you do not have access to learn oncology in the specialty practice area, or many of you are not even exposed to these drugs during your family times. At least this platform, we have taken an initiative to teach you oncology at your doorstep from your mobile, wherein which you can learn the concepts, involve in different things. And we are going to launch a program for oncology. And sir, can you just brief on it and we'll go for the launch?
Yeah, absolutely, no problem. So basically, I have shared with you the Word document as well. You may open that and explain from there. Basically, participants, this is a 3 months training program, and it will be conducted on Zoom. Dr. Pravallika will be heading the program, and she'll be clarifying all the doubts to you from that may arise. We have already created a WhatsApp group and also a LinkedIn group for this, wherein you can join. You can ask your doubts and clarifications. And these classes will be conducted depending on the number of participants we get. We'll do a proper planning of the timings as per your convenience, so that all of you can join online. We'll also provide you the recording of the live session so that you can watch it, and also you can clarify doubts through the doubt clarification sessions. So the syllabus and everything with Dr. Pravallika will explain, and from there we'll continue. So yeah, the email, you can check the email. All the details are there in the email. And we'll answer all the questions. So don't worry, stay connected here. We'll continue with the Q&A after the session, and then we'll answer all the questions that you may have.
So guys, I'm very happy. It's my dream to teach oncology to students and make it more accessible, the oncology learning to students, taking a chance and initiative, and we'll all learn together in the process. And I'm very happy for the launch of the program today. So we are launching this. and I welcome you all. And before what is this unlocking oncology learning with OTP? So you forget something, right? Whether your password, you forgot something. For everything, you have to log in through your email ID. What is your phone ask? You purchasing something. What does the delivery guy ask? You're ordering some food. What does it ask for? OTP, right? So for everything, you need something called as OTP. So even to learn oncology, we are going to launch a program in a platform on the name of OTP. So unlock your oncology learning with our OTP. So it's an oncology training program. So I welcome to OTP, the oncology training platform, where pharmacists embark on a transformative journey into the world of oncology. OTP is a comprehensive platform designed to make oncology learning easy, engaging, and accessible for pharmacists of all levels of expertise. So, empowering pharmacists through tailored oncology education. So, you can unlock your journey. So, I want to explain you about the course, how this course is being designed. So it is designed to provide a comprehensive learning experience through theory classes and practical sessions. This practical based learning includes case discussions to enhance understanding. The module equips participants or all the students with essential clinical pharmacy skills necessary for practicing in oncology settings. It emphasizes the application of combination of skills acquired from various pharmacy subjects like pharmacology, pharmaceutics, pathophysiology, and all other subjects. The focus is on the practice of evidence-based medicine to enhance the quality of life for cancer patients. Additionally, the students will gain knowledge on the principles of compounding chemotherapy, pharmacotherapy of anti-cancer drugs. This is about this specific module which is going to be started, and through this module participants develop a strong foundation in oncology clinical pharmacy, preparing them for effective and informed practice in this field. So it has modules and it has 3 levels: basics, advanced, and comprehensive. uh, and I'll share with you the curriculum for the first module, and it will be in the form of different modules, wherein which the basic modules will be for long duration of time, later which you will have individualized cancer modules. So the key features of this would be live lectures, practice questions, group discussions, and individual consultation. It's based on priority of practice and request basis, wherein which you will have an individual session to discuss with the experts and learning sessions. And the people who are delivering the lectures would be physicians, people internationally and nationally practicing clinical pharmacists, and myself. And benefits is knowledge empowerment, interactive learning experience, career advancement, and patient impact. So you will be having introductory quiz, skill building assessments, and mastery assessments, which includes case studies. And students will be given certificates at the end of the course. For that, you will be given assignments which you will have to submit before the end of the course. And it will be given at different levels during your classes. And group discussions plays a very major role. You will be given a topic on which all of the participating students will come together to discuss on a topic and also intervene with live cases and different aspects in oncology. And before we go for, I think you all need a break or boost at 11:30 or coffee or something. Before that, sir, can you please share the document here?
Yeah, I've already shared with you via email. You can open from there.
Okay, sir.
You can download it first and then open the Word document and share with the participants. Meantime, any questions? We'll just compile everything and then we can discuss once the session is over. So this planning we have been doing for a couple of months now. We got a lot of queries from clinical pharmacists, and they wanted to learn oncology, not just clinical pharmacists, physicians also, and others practicing pharmacists as well. So anyone who wants to learn oncology, this program is for you. There is a lot of detailed information that will be shared here. And this is a very compiled information document that we'll be sharing. And all these sessions that we'll be doing will be live. So you can clarify the doubts then and there. It is not like other programs where you get some recordings and then you don't know what to do with the doubts, right? So we'll have live classes happening so that you can ask the questions then and there. And we'll have experts from different places who will be sharing the information so that you can learn from there and you can also practice it. We'll also be sharing some career opportunities later on with you based on your area of interest. And that is what the holistic option that you have thought of for this program. Does it sound interesting? Type interesting if it sounds interesting to all of you.
Sir, is it visible?
Yes, it is. Yes. Yeah, you may share from here. You do just click on the scroll button on the right side to go to the next page. Yeah.
Basics, it includes, the level 1, level 2, and level 3, as I have told you. The level 1 is basics of foundational pharmacy. So it will introduce the participant or the student to the introduction to oncology clinical pharmacy practice and basics of foundational pharmacy, all the concepts that is required from you from your farm day as a revision, like how you can apply into oncology clinical pharmacy practice, fundamentals of cell biology and cancer biology, all the key concepts that are required for you to gain expertise in oncology. All the therapies with cancer are related to cell biology and also cancer biology. Without the foundational knowledge of cell biology and cancer biology, you will not be able to unlock anything in oncology pharmacy practice. So all the concepts and all the fundamentals related to cell biology and cancer biology will be discussed. You need to know about the pharmacokinetic and pharmacodynamics in oncology and how to do it. And you see the TDM also is there in oncology. And you need to know pharmacokinetic and dynamic principles, as I have discussed with you about the narrow therapeutic index drugs of this chemotherapeutic drugs, and also, the targeted therapies or all the anti-cancer therapies used in cancer. So you should know how to apply these pharmacokinetic and dynamic principles in your practice. So you will be learning all that in this chapter. And pharmacy calculations varies from different range of calculations. It's not just that you incorporate a body surface area and also you put an AUC and calculate some dosage to the drugs. It includes so many critics, in dosage calculations, from the conversions to the, how to prepare your own drug with serial dilutions and multiple baggage methods and infusion of syringe pumps, and how do you administer drugs, how do you calculate things to practice in a intensive care setting. So pharmacy calculations does not mean only the basic calculations. It includes the advanced calculations from basics to advanced and oncology pharmacotherapy. You will be given an insight to all the different types of pharmacotherapies that are there in anti-cancer treatments. And clinical skills in oncology pharmacy practice. What is this clinical skills? From the time the patient comes into the ward till the patient leads and complete his journey of treatment, all through the process, what are all the clinical skills that need to be acquired by a clinical pharmacist for that oncology pharmacy practice area? How to monitor an error, how to document adverse drug reactions, how to study, how to, intervene the case sheets, how to do everything, what is the step-by-step process. You will be taught everything. There's so many clinical skills that you need to learn. So all that will be discussed in this chapter. And clinical pharmacy workflow and documentation. How a clinical pharmacist, I told you your roles and responsibilities varies from hospital to hospital settings. In different hospital, in different settings, how your workflow should be there, how the document should be maintained, how you should do, in the clinical rotations, interdisciplinary, multidisciplinary rounds. Why are they important? What all activities that you can perform as a healthcare team? And how do you do it practically? And practice management. Like, like in practice, what all you will do in a practice management. as a clinical pharmacy practice professional. All that will be discussed in this level 1. In level 2, you will be having practical experience, how to do chemotherapy preparation audits. For everything there is an audit, for everything there is a checklist. So you need to understand how to handle the drugs, storage, transportation, all this standard operating procedures, guidelines, and what are the principles of chemotherapy compounding. It's not principles of chemotherapy that is theoretically you can see in Tripathi. That is not exactly what it is. There are so many additional things. Even to understand a research paper in oncology, you need to get specialized with so many research terms and all. So all that will be there in the basic foundational pharmacy course. And in practical experience, you would be seeing the critics of chemotherapy admixtures, of chemotherapy calculations, critics of administration of chemotherapy, routes of administration of chemotherapy, how to administer, how to take care, what to check, what not to check. Everything in detail you will be learning in the practical experiences. And practice modules. You have something called as quiz, skill building assessments, mastery assessments, group discussions, and 5 assessments will be, assignments will be given to the students and they will be assessed before giving you the certificate, and you will be discussed. You will be having, so all this will be discussed after with all the people how the things are going to be in detail after the commencement of the course or before the commencement of the course. And I have explained you about the benefits and advantages of this course. So additional skills that you will learn is your communication and presentation skills, gain self-confidence, handling adverse situations. You'll be able to be a team player, and you will be learning how to build in, connections, how to use your different platforms to for search of jobs and to develop area of expertise in a specialized area or in your area of specialty, whichever you want to do, mainly oncology. So guys, uh, so many people may be having so many, and I'm telling you again, all this information is on Google, but somebody needs to curate the data, organize the data, and give you in a way that you can practice in your area of specialty is the unique challenge to anyone. So we have taken the challenges to meet your expectations. So you will have basic module 1, basic module 2. After learning the first module, you will be able to understand second module. Okay. So this is how the sessions will go on. And it will be a slow practical based learning. So I think, hope you're clear. I think everybody is live and on
Yes,
the go.
Doctor. Yes, Dr. Pravallika. So,
So
any
if you have
doubt?
any doubts, you can just post
Yes.
it here and you can call back to us or you can write to us. So you may get doubts, ma'am, how the sessions are going to be. How are you telling skill building assessments? Okay. You can ask me a few questions and by 11:30, I can answer your questions and then I will show you something. Some Sunday boost for you to understand how your sessions, interactive sessions are going to be. You can experience it practically now. So before that, any questions, I'll answer.
Absolutely. So there are a few questions. Shall I read out for you?
Sure, sir.
So there is this question from Vishal. He says, "Hi, ma'am. I'm doing Farm D, fourth Farm D. How
Okay.
will how will it be helpful to me? I'm not sure what I'll be doing next."
Okay. So I also told you in my previous words that it will help students at different level of expertise. So the level of expertise of clinical pharmacy of 6th-year students is changing with 4th-year student. As a PharmD 4th-year student, you are studying clinical pharmacy as a subject. And when you can incorporate those concepts simultaneously into your practice, when you go to the hospitals, because for your therapeutics classes, you will be assigned to the hospital during your practical classes. If you have an oncology department in your hospital, and if you can incorporate those concepts and check through the case sheets, anyhow, in your therapeutics 2 and therapeutics 3, I think you will be learning about oncology. So it will surely help you and you will have a clear cut idea from your 4th year. Your concepts would be more clearer when you start learning it simultaneously along with your clinical pharmacy, and you will be incorporate these things in research when you come to fifth year and practice it in an extensive way when you come to sixth year. So instead of learning it in sixth year, when you start off at an early stage, it's little bit difficult and challenging, but we are here to guide you through the process, and you can become an expert by the time you come out to sixth year. It would be a slow and more intensive learning rather than, it's a fast track process when you're in final year.
Absolutely. So it is always better to join these courses when you are still in your maybe second year, third year, or fourth year, so that you have the learning happening by the time you complete the course, right? All right, perfect. Thank you, Vishal, and thank you, Dr. Pravallika. There is another question from Faiz. Ma'am, I am B.Pharm student, but highly interested to work as clinical pharmacist in oncology, planning for OSPAP and exam in UK. Will this course gonna help me for that?
I can tell you, as a B.Pharm student, sir, I think many opportunities are coming up in medical writing, clinical
Yes,
data management, all these places. And most of the clinical trial data is related to oncology
absolutely.
in most of the companies. So you can, even without, I'm not telling you not to go for postbac. Postbac gives you the practice, clinical pharmacy experience as a B.Pharm graduate. If you want to choose and if you want to work as a clinical pharmacist specifically, this would surely help you, and it would help you when you want your specialized area of practice to be an oncology.
Absolutely. So
And
this
if you
course
work
is
in as an industry in different departments of medical writing and all, in different areas of medical writing also with development, always to practice in an area to get a job, it's not the degree that you have. You need to upgrade your skills, whichever the degree you have. Maybe you can learn oncology simultaneously medical writing. So both these concepts and skills would help you work in an industry.
yeah,
If you learn the skills in oncology and learn the skills of clinical pharmacy, that would help you become a very good clinical pharmacist in the hospital.
absolutely. Not just clinical pharmacy, even community pharmacist, clinical pharmacist, even hospital pharmacist, any type of pharmacist, knowledge is definitely no bar for you, right? Whatever knowledge you gain, definitely this knowledge will help you in some way, right? So if you are very focused on learning oncology, this course is definitely for you. And I have been discussing with Dr. Pravallika for almost 2, 3 months now that everything has to be included in this course. Even we should start the course from basics for people who have no idea what oncology is. It should start from there, right? So we'll cover right from the basics to the advanced module, and depending on how much you want to learn, you can continue your learning. Is it clear? Yeah. All right, Faiz, we hope you answered that. Give us a thumbs up. All right. Perfect. Next question will be from what are the prerequisites? This is from Akhil. What are the prerequisites and application requirements for oncology fellowships?
Prerequisites mean you should be a PharmD graduate, sir, in
Yeah,
India.
yeah, that is the prerequisite. Yes. All right. Ma'am, which hospital can we have fellowship or residency?
Right now, JSS is offering residency and fellowships. You have it in Ramaya and HCG and Shankara Hospital. And Tata Memorial have 1 year. It's a different program.
All right. So what we'll do, maybe, we'll provide a list of the hospitals where these programs are available, a detailed list in the groups. We have the groups. So we'll provide them in the groups as well. Ma'am, what is the scope as oncology clinical pharmacist in overseas countries? This is from Fayez again.
See, oncology clinical pharmacists have wide variety of scope when compared to India. I'll tell you how it differs. The area, how I told you, how you're specializing from clinical pharmacy to a specialized oncology pharmacist in India, making you stand out as a specialty clinical oncology pharmacist and giving you a specialized area of practice. Even in oncology, when you see the physicians, they know surgical, radiation, and medical oncologists. Even in medical oncologists, everybody don't go for hematology and bone marrow transplant units. In US, you have different settings, ambulatory settings, breast cancer clinics, lung cancer clinics, hematology clinical pharmacist, BMT clinical pharmacist. Even in the specialized clinical pharmacist will focus on a specialized area wherein which he can practice and gain more narrow expertise in that area. In overseas, you can go for a program, but it's a little bit time taking. It's more than 3 years. It will take you time because you need to clear the exams. You need to get a licensed pharmacy in US, and then you have to take for postgraduate year 1, year 2, you should be qualified, and then you have to do it. But if you have an experience and expertise in India for more than 4 years, when you can see for BCOP certification, wherein which the eligibility criteria is there on the internet, you can check for this ASHP, this portal or BCOP guidelines. It keeps changing. Based on that, if you're eligible, if you clear your exam of BCOP and then clear your licensure as a PharmD in US, you can practice in US settings. There's so much of scope for oncology pharmacist or, in US and other countries.
Absolutely. Yeah, so I think we answered all the questions. There are a few questions related to the fees and enrollment and all of that. We'll, provide all the details later on. So there is one question from Snehita. How do we choose the particular department for specialization to do, as there are many departments?
So it all depends on area of interest that you have.
Absolutely. Yeah.
You may not have a course that is being given in India right now for specialty. You can go and work in a hospital. I have told you about different hospitals previously in my slides, exclusively for cardiology. You can work as a clinical pharmacist in that hospital. Simultaneously, you can take efforts to learn with the physicians with the application of these clinical pharmacy concepts in cardiology area.
Yeah, absolutely.
And any other special skills required, you can acquire through practice. So these modules will surely help you incorporate the skills that pharmacists need to put in any specialty area.
Absolutely. All right. We answered all the questions. So Dr. Pravallika, you may continue with the Sunday hangama.
Okay, guys, something interesting you want to know, ma'am. It's so much of complexity in oncology, so much difficult. Like, will we be able to do? I'm at the level of second year, I'm at the level of third year, fourth year, fifth year, sixth year. Ma'am, I've already done my PharmD. I don't have any opportunity in the hospital. Now I'm practicing, I'm sitting at home. So I think if you would have been curious and you would have been listening to me from the starting of my slide, you will be able, you can just check. I'll ask you with some, sugar pills. You think the coffee cup in your hand don't have a sugar pill? I'll be giving you a sugar pill. Please enjoy the sweetness and also just tell me the taste after every sip by answering these questions. So, sir, can you see my slides?
Yeah, they're visible. Yeah.
So we'll have your Sunday boost. So wake up. You can see something here. Guys, you can unmute your...
Yeah, all of you can unmute and talk, no problem. That right is given to you.
Can you tell me what do you understand through this picture?
Whoever wants to answer, please just unmute yourself and talk. This is the best way
Anything,
to
just
answer.
try out, Try out. It's
There
one
is
sugar pill.
there is no right and wrong here. Okay.
Yeah, just try out.
Yeah.
In few cost of medication, many like a month's grocery can come.
This is from Akhil.
So anybody want to try? Any other answers?
Ma'am, it's about the expenses of medications.
Mm.
If you particularly talk about anti-cancer medicines, target therapies cost around 16 to 20,000, and it is much equals to our worth of groceries.
So you spend 20,000 on groceries?
Not just about 20,000, but about all the things, all the expenses of our home.
Okay. Anybody?
Please try. There is no right and wrong here.
So
At the end of the day,
you
we
can
are
see
all
here.
learning.
Okay. For this sugar pill, I will give you the taste. See, if you put equal amount of money in your groceries and a month's worth medication, how much of groceries you can buy, and you see how much of medicine you can buy.
Yeah.
If you think you are a pharmacist, how can you cut down the cost of months worth of medication of a patient? With your skills and expertise in patient counseling and also drug utilization evaluation studies, pharmacoepidemiological studies, and also doing something cost cutting therapies, how to pharmacoeconomic studies. As a clinical pharmacist, you can help out the patient to cut down the investment on medication by improving patient health through counseling, community awareness programs, all this. So in this module, you will have such pictorial things wherein which in the group discussions, you will be given some topics wherein which it will give you time to think and analyze on a clinical situation how you are going to do this for a patient.
Absolutely.
Okay, understood, guys?
Think like a pharmacist.
Yes. Next. One more. Next sugar pill. See here. Guys, can you guess the first picture, the second picture, this one? Okay. Before that, you see this?
The second picture.
Yes, the second picture. What do you understand when you see the second picture? There's no wrong and right. Please do answer me. Open, unmute your mics.
Drug buildup in body and it may cause toxicities.
Okay, drug. When the drug will build up in your body?
And when metabolism is slow or renal function is lower,
Hmm.
like kidney is not able to clear the medicines.
Hmm.
Uh, and in case of higher doses, of therapeutic.
Okay,
Or
any other?
in
Do you
case of
think the
subtherapeutic.
patient is very rich? He's getting so many medications from the pharmacy and he's taking it.
Shraddha says a lot of tablet taken by the person. Mary Asha says drug
Lack
use.
of proper counseling.
Okay, lots of that drug resistance. Oh, so many. See, so many things comes into your mind, right? But
Because
for me, it makes me say that this person is very rich. You know, earlier, my grandfather's time, great grandfather's time, they want some protein. They used to take some dal, some egg, some chicken, some meat. Means different people, whether vegetarian, non-vegetarian. They're healthy. They eat at specific time and do the things. So they're not deficient of anything because they're including vegetables, all the naturally man-made and acquired from the nature for their food, even for the treatments or everything. But nowadays, everything is ready-made. I don't have magnesium deficiency. You get pills. I have iron deficiency. I get pills. And nutrition, you have nutrition supplements. Nothing is naturally acquired. Everything is man-made, synthetically made. So your body is not, it has its own mechanism wherein which it is not designed for all that. It is designed for a natural mechanism and you're educating your body with all the new experiments, all the new trials, rather than following a healthy lifestyle. And for everything you are supplementing yourself, Can everybody do that unless you are very rich? You can think that way. When I ask someone else, they'll tell, ma'am, polypharmacy. Maybe he is having multiple comorbidities. That is why he is taking so many pills. And when you think in a girl's perspective, they'll tell, ma'am, obesity is the main problem. This food contains carbohydrates, so much of fats. Instead of taking that for an iron supplement, if I take an iron supplement, that will not give you extra carbs. So the thought is different. But ultimately, you're taking so much of medicine. So that's what I told you. Think as a pharmacist. Think as a girl. Think as a business person. So how do you think? That picture projects you to think in different routes. But whatever the route, you're aligning to one place where you are dumping a person, a human, with multiple use of medications. And because you have purchased it, some greedy fellow, because they're getting expired, he will start taking multiple multivitamin tablets every day. And his wife keeps telling, what the hell are you doing being so greedy? So why all this? It's lack of proper education on the use of medicines. So there is no rational use of medicines. And it will tell you to act and think in a way how you have to be actively participating to educate patients in your area of practice on rational use of medicines and also rational use of proper way of administration to get good outcomes, and also choosing drugs as formulary management expert with the physicians as a healthcare team, also as a part of the pharmacy and therapeutics committee member in the hospital. So the picture is simple, but the thought is more and your role is also more. So I think you enjoyed the sip. And next. So can you see here? So guys, can you guess? This is the first roles and responsibility that I have discussed with you people when I started my presentation.
Medical reconciliation or history.
Medication consultation. Pharmacist consultation. So how are you going to correlate that with this picture? Yes, you are correct. And add on one more. Please do answer, guys. That's okay. Try. You can see the caption here. Yes, everything. I need a list of all the medications you are on. You have seen the previous picture full of polypharmacy, full of medicines the patient is taking. And this is the clinical pharmacist, this is the patient, and you're asking something, what it is. Medication, history, interview. This is a very critical role I have told you that you need to perform when the patient comes to the hospital. In case of a teaching hospital, it will be done by the pharmacist. You can go and engage in these activities, but in a community hospital or something, all this data will be collected from the patient when he enters the hospital. So it's your responsibility. Why you need to take all the medication history from the patient, and why do you need to perform medication reconciliation of the patient? Can anybody answer? Okay, good, Mary, Asha. Okay. Good, good. All of you are correct. Okay. So this will help you tailor the medication regimen of the patient, or also, tailor the treatment based on individual needs of the patient, based on their genetic genetics and also, epidemiological factors, considering all the patient factors, drug factors, treatment factors, economy factors, ecological factors, everything you will be considering to tailor the treatment for better quality of care and outcome. So, and another thing will come up. See, this is for the pain and these are for the side effects. What this picture shows you here? What can you understand from this? Come on, guys, answer this question also.
As anti-cancer drugs have major side effects like nausea, vomiting, and other things. So, to manage symptomatically, we need to give like other drugs.
Okay. That is what doctor is doing. But as a pharmacist, what would be your role here?
Ma'am, to optimize the drug to avoid the side effect.
Okay. Per se, you want to optimize drug in terms of nausea and vomiting. So I could
No,
tell you. Okay, yes, tell me.
like in case of chemotherapy, we can optimize according to the patient and like to minimize the occurrence of these side effects as much as we can.
Mhm. Okay, your answer is correct. And I will tell you it in a more simpler way. And with advanced treatments and technologies, the drug is coming into the markets very fast. And because of drug repurposing, all these things, many drugs are used for different conditions. Other than the labeled conditions, you're getting back their use for like metformin being used in anti-cancer therapy. You know how you're getting non-labeled indications by teaching these old drugs new tricks. You are getting them into practice. So you will not be understanding what will be the newer adverse effects. So pain itself is a big issue. Taking chemotherapy itself a big thing, and additionally pain you will have, and you will have so many side effects of the pain medications. So you can see a cascade of prescription, prescription cascade, wherein which for the disease you will be being treated, because of which the main treatment you will be getting adverse effects. You will be giving to prevent those adverse effects some medications. And because of those pain medications to treat that adverse effects, you will be facing some other adverse effects. So there's some prescription cascade. So decrease this cascade and deprescribe these drugs. In oncology care settings, you need to have medication expertise. So if the patient has some certain pain, for example, you want to give medications for pain, you should choose the drugs considering the patient factors that will lead you or, make the patient not experience further side effects because of the treatments that are prescribed to treat the adverse effects of the main treatments. I think you understood. Like you have prescribed some morphine to treat pain, severe pain with anti-cancer therapy, and it has constipation. And to treat constipation, you are prescribing one more drug. So as a pharmacist, you can choose a wiser therapy which is better than morphine, with which the patient can get effect or cure for his pain. So that is by considering patient factors and gut health of the patient. And you should be able to assess which cancer the patient is having. Again, if it is GI cancers. So how would you choose the drug? Because availability, absorption, kinetics. So you need to understand the kinetic principles. So how do you incorporate them into your practice? So picture looks simple. The way you think, how you do practice, how to choose the drugs. This is what you will learn through these chapters practically. You can see here, why patient consultation? So many dumbed drugs. Guys, can you answer this question? I think it's not difficult.
Drug interaction. Anusha says drug interactions.
Yes.
Mary says and drug interactions.
Yes, drug interactions. You need to monitor them so much carefully because many anticoagulants and so many narrow therapeutic index drugs are being used in this critical area of practice. In people who are on anticoagulants and need to take cancer therapy, they need to be monitored. Not only anticoagulants, other drugs also keep reacting. Patients who is on thyroid medication, and you see so much of, pantoprazole and all prescribed to patient, to combat the gastric side effects during cancer therapy. And, patient is on thyroid, how to tailor the therapy, how to understand the critics of it, how to tailor the time of administration of the drugs, how to prevent the reactions, how to increase the effectiveness of individual drugs used for different therapies. Suppose if you are not able to, where there is a drug interaction between this pantoprazole and also, um, pantoprazole thyroid medication, anti-thyroid medication. So how do you do that? How do you tailor the therapies? How do you increase the efficacy? If thyroid levels are not maintained, you will see some other adverse effects because of decrease in thyroid hormone levels in your body or increase in thyroid levels in your body. So that would be an additional side effects to your therapy. Patient may not be able to combat with all that. So how do you tailor all that? And monitoring drug interactions and doing medication reconciliation, what you have done, and patient consultation is very much important. And your expertise in this area is so much important to understand, like how severe the interaction is, what you have seen based on the evidence based practices, whether really practically seen or you can predict it from occurring. All that you will play a very major role, and it will definitely have effect on quality of care and standard of practice and your expertise as a clinical pharmacist. Can understand something? This also you can answer if you would have listened to me in the emerging trends in oncology and the transition of treatments in oncology. If you understand that slide, you can answer this question. Anusha says it's alternative therapy.
Alternative dosage form.
Patient complaints. Okay, Snehita, in one way, taking tablets may have better compliance when compared to injections. So one way we can take it. But I've given you a hint as emerging trends. You see so much of, earlier when you say chemotherapy, it's only IV. Most of the chemotherapy is IV. And you see some hematological treatments, the hematology and all started using pills. Hormonal pills, chemotherapy pills for your cancer to cure your cancer, like imatinib, and also some wonder drugs in oncology. And you see, development of so much of oral chemotherapy. And patient will be adhering to therapy, will be preferably taking oral when compared to injection. So you should play a role, in oral chemotherapy setting. You should have good knowledge not only on non-chemotherapeutic or non-anti-cancer therapy medications, but also how to take chemotherapy pills, how to handle oral pills at home, because these are not administered for most of the time in the hospital. They're taken at home. So even that you cannot handle with your hand. How to handle, what are the precautions, how to store, all that you will learn about in the modules. So this is another area of practice where you get expertise as an ambulatory care oncology clinical pharmacist to counsel patients on oral chemotherapy. So something from this picture?
New drug development.
Okay. Anything else? Yes, it is something new drug development. A new drug comes into the market. How I told you biosimilars and all. So a company expert, you can be a person, a liaison between a company and also, a healthcare professional, wherein which you can, concise the information related to the drug and you can explain to the physicians. And when you want to explain to the patients, you will be able to acquire skills through good skills in writing into a simple, understandable language of patients, like patient information leaflets. You will be able to making all that materials like educational materials. There you can get good jobs, job opportunities, and during the clinical trials in the hospitals, you will learn. You will have satisfaction of administering these trial drugs to the patient, learning new drugs, new methods of administration, and also new adverse effects. You'll be able to learn new. See, when it is new, it's exciting for the pharmacist. It is exciting for the physicians because you're getting a drug to administer to the patient free, and you're getting patients, you're getting something to learn in terms of diagnosis and outcomes. For a physician, for a patient to learn, for a physician, for a pharmacist to learn about the drugs, the administration, storage on every aspect of the drug, and making patient education materials, educating the patient on this, monitoring the patient, follow-up of patients, and also follow-up during transition of care from multiple departments. And how are you going to handle it? How are you going to handle a patient in the ward? How the nurse is going to administer a drug, watch, learn, and satisfaction in terms of physicians also, for patients also, pharmacists also, nursing also, even for the company when you get a good outcome. So you play a very crucial role in monitoring clinical trials. And when you want to shift your job from hospital to company, you'll get to learn, you'll be having so much of practical knowledge, wherein which you can use your skills of writing to transform them into materials, which can be made into patient information leaflets. So something new, everyday learning new is very exciting. And this oncology area is one area of practice where you can incorporate your critical thinking skills to learn oncology and practice oncology. And so everything is new, the course, everything is new. And future, expecting for something, there's something called a side effects consultant. If you don't, you will become experts in that. I hope this role will not be incorporated into a practice. Being an inpatient clinical pharmacist, we would reduce our role to be as side effect consultants by prevention of side effects and management of patients in the ward. So I am against this role coming up, but managing it before even this role comes up, we should be vigilant as clinical pharmacists. Hope you all agree with me. Let us not have a separate consultancy, but let's work as a part of healthcare team, preventing side effects or adverse effects of cancer. So, as our theme says, enhancing patient care and support, enhancing the quality care and support to patients. And let's all join hands to prevent and also, in this increasing burden of cancer, let's all play a important role in giving better life to the patients. And through awareness programs and community awareness and also prevention programs like vaccinations. Now we have seen breast cancer awareness programs, cervical cancer awareness programs. Doctors don't have enough time to participate in all this. And we all can be part of it in encouraging vaccination, education, patients, educating people at different areas in institutes, colleges, and all this in prevention of so many cancers in India. And for that, we all need to acquire knowledge and skills. Let's I want you all to be a part of this and learn through the process and use your skills for the upper, better, I won't say disease-free India, a place where the treatments can be given in a peaceful way and affordable way and increase the access to healthcare facilities by being a workforce who can contribute to better healthcare.
Ma'am,
Yes,
stem
and one
cell
more.
treatment.
And this
Stem
is,
cell.
yeah, just answer this question. After this, I'll answer you. So my physician prescribed a customized formulation for me. Here is my DNA sequence. So I told you about precision medicine, how treatments are going to get personalized with more advancement of diagnostics in healthcare. Yes, you can ask me. We're open for the questions.
Ma'am, stem cells treatment used in cancer.
See, practically, it's not yet being done. See, CAR T cell therapy is also they're doing. I think one case they have done recently for CAR T cell therapy. So all these therapies are not into practice as such in India.
Okay,
It's
ma'am.
still in trials. That's what I'm telling you, the future. Everything is the future. Because you know the cost of healthcare, just it's not that you can give the treatment to a patient. You know, the equipment, facilities are still not available completely in India.
Yes, ma'am.
Do you agree with me?
Yes, ma'am.
To provide a bone marrow transplant to a patient, you need such facilities wherein which patient can be monitored and delivered the therapy. And the cost, is it affordable? Does it cover the insurance? And in India, most of them don't have insurance. The health strategies are in the pipeline, but it's not completely established like foreign countries like US to take the costliest treatment. Even to many of them are not aware of the basic chemotherapy that is provided for free with the governments through ESI hospitals and all. You can see like even a lower income people can get treated. Any other doubts?
Ma'am,
Yeah.
that's pharmacogenetics is considered before like preparing the drug regimen in India.
See, pharmacogenetics, there are some tests. You know, this is something called as 5-fluorouracil. So these drugs will have to need to be done genetic testing to see whether the patient can come back, whether the patient can metabolize the drug or not. But most of the Indian setting, based on the evidence, are tolerating the chemotherapy with 5-fluorouracil. In case if patient experiences toxic effects, they'll go for checking for the drug resistance or the genomics of the patient. But for diagnosis and to start the treatments, you're seeing so many tumor markers that have been developed recently for the diagnosis, like BRCA testing, and you see the NGS panels, and you see in lung cancer EGFR mutations. And in breast cancer, triple positive, triple negative breast cancer, where you can see estrogen receptor, progesterone receptors, and HER2 positive. And when you know what is the reason for your cancer, to treat them is better, easy. To target one specific target is easy when you have a targeted drugs like Herceptin or trastuzumab, rather than when you don't know what to target, triple negative breast cancer. So for individualized cancers, based on the guidelines, the genomics testings are performed to the patients in the workup. You know how when you work up for prescribing a treatment, all these are considered. And based on requirements, these tests are ordered and then the treatment decisions are taken.
Okay, ma'am.
Okay.
Thank you. Well explained.
Thank you. Any other doubts?
Ma'am,
Yes.
there are some of the chemotherapeutic agents which are, I think, 10 to 12 hours of infusions. For example, IFU needs 24 hours of infusion.
Yes.
So currently, port is immersing machine inside the body. So in a ground reality, do patients using more this technology of port?
I'll tell you, there is something called as infusion pumps for 5FU, okay? This infusion pumps will be like, it will be fixed rate pumps, fixed volume will be there where you have to put the complete dose of the drug in that infusion pump and you will be sending the patient home. It's portable. See, and another thing is when you want to administer 5FU for long time and everybody cannot afford to that infusion pumps and everywhere there is no practice of infusion pumps because it needs to be purchased from a pharmacy separately by the patient. It may not cover under the cost of the treatments that is provided under different schemes. You got my point? That is why still we are not seeing it in the practice. If you are getting it at a cheaper price and the availability is there and the production from the companies is good, and then you can incorporate into your practice. And you see most of the time, PICC lines, PICC lines. There are PICC lines inserted for a patient taking treatment under cash in a private hospital. And so you would not see so much of extravasation to the patient. Because PICC line will not, you will not be pricking the patient every time. But patient who is taking chemotherapy through peripheral IV lines may have extravasation and need to be monitored. You got my point?
Yes, ma'am. And what is the success rate? Those who are using these infusion pumps, are they successful?
So the first cycle they will observe. Always the first cycle is challenging every time. They'll be monitored. So for second cycle, they will send the patient home with all the precautions. First cycle itself, they don't send the patient, most of the patients home, but they'll be monitored in the daycare or even as an inpatient.
Yes, ma'am, correct.
Because and people, even the patient attendant needs to be educated and you need to consider the patient factors of age, comorbid conditions, and his chances of getting adverse drug reactions. Sometimes patient may tolerate the first cycle of chemotherapy and during the second cycle, if the brand of the drug is changed, sometimes the batch will have defects. Patient may develop adverse drug reaction. This is one chance. So always it is that take chemotherapy systemic infusions under supervision. Okay. And you
Yes,
should
ma'am.
see even the performance status of the patient who is taking chemotherapy also. If physically fit and fine or is bedridden, all this needs to be checked.
Yes, ma'am. And one last question: that do physician and medical oncologists, or as a we clinical pharmacist, just go through the only NCCN guidelines, or are there any other guidelines are also there?
See, most of the practice is through NCCN guidelines. And I will tell you one example, even NCCN guidelines in like gastric cancers take capecitabine to be given 1000 mg per meter square. In most of the practice areas, you will see 850 mg per meter square being started to the patients. But guideline says 1000 mg per meter square. Initially, the dose will be given at a lower dose and then they'll tailor it. This is all based on patient factors. But the combination of drugs does not change. And incorporation of these targeted therapies along with chemotherapy depends, may not be on the exactly on the guidelines that are in NCCN, maybe from the evidence that they've been acquiring to clinical trials. Because the data is not yet incorporated in NCCN. So the guidelines keep updating every time. Understood?
Yes, ma'am. Got it.
And based on that evidence that supports them, maybe that have been done on 10 patients, may not be that in your area, maybe some other country. Some physicians may take a chance, some may not take a chance. It all restricted to individual practice, but prescriptions are prescribed based on guidelines and the level of evidence. The protocols are chosen.
Correct, ma'am. So based on patient factors, protocols might change as per the condition.
Listen, patient protocols are not changing. For example, I'll tell you, in breast cancer, when you're seeing AC regimen prescribed to most of the patients, right? So the level of evidence of how many number of patients who have taken AC regimen for that condition have recovered. Level of evidence is high. The newer drugs now are incorporation of trastuzumab, this pembrolizumab in breast cancer treatments for targeted therapies. Okay, but the level of evidence of this combination is less. Yes or no?
Yes, ma'am.
So you have suppose another example of two different immunotherapies in patient. The level of evidence is less because the availability of drugs is not accessible to all the patients. Yes or no? And
Yes,
when
ma'am.
you see the level of evidence is very high, that out of 10 patients treated, 9 are benefiting, the doctor may take a chance. And if it is the same Indian setting, suppose if you want to do something here, and if the level of evidence, and that also evidence says this is not in our area, but it is being performed somewhere in some other country, African countries, and their genomics is different, and they have found only 5 patients benefited out of 10 patients. Will doctor take a chance for that therapy, or will doctor take a chance for the therapy where you have level of evidence high in your area with 9 by 10? You got my point?
Yes, ma'am. High evidence.
Yeah, based on level of evidence and patient factors, the cost and all other criteria, and also the facilities available to give the treatment to the patient. CAR T cell therapy is there. It is less cost for you think. But if you don't have facilities and infrastructure to give that and expertise to give that, will you take a chance? No,
No, ma'am.
right? Yes. Any other questions? I think we have covered everything, and we have covered everything in today's session related to oncology pharmacy, and this video will be available online through LinkedIn and all. And guys, you can join the LinkedIn group using this QR code and join this WhatsApp group for further updates and queries. The brochure, the fees, everything will be shared soon. Ugadi is going to come. Happy Ugadi, and for the new year, new learning and everything you will be getting soon.
Yeah.
So you can join the LinkedIn group and WhatsApp group through these QR codes to get the updates. And please do share with your friends and colleagues about this. And thank you. Thank you all for your patient listening. And anything you can ask through WhatsApp group. And thank you, sir, for the opportunity and session and for inviting me here. Hope you all had all the insights in oncology clinical pharmacy practice.
It's my pleasure, Dr. Pravallika. Thank you so much for sharing so much of information about oncology and the role of oncology pharmacist. Learning is very important. We know we can all learn from YouTube, but there is no systematic learning happening there. We'll have to spend a lot of time and energy in searching information, then compiling the information and that link. And I think the way you have curated this whole course will definitely help a lot of pharmacists and healthcare professionals learn oncology. Please be part of these two groups. The QR codes are displayed on the screen. You can take a screenshot and also join them later on. I've also shared the link of the groups in the chat box. You can join directly from there. And then we'll share more details with you later on in next couple of days about the course, the plan, the syllabus, the fees and everything. So stay connected, keep learning, and connect with Dr. Pravallika on LinkedIn and ask questions if you are interested. You can also ask through these groups. And then you can also connect with me if you are interested to continue your journey. So thank you so much, everyone, for your time. At this point, we'll end the session. I have another session starting at 12:30. So that is on regulatory affairs. So if you're somebody who's interested in learning regulatory affairs, you can discuss with me later on. So thank you so much, everyone, for your time. Please share these resources with everyone who you know. Let's learn together. Let's make the pharmacy profession a more interesting one through our continued learning, because learning is the only way through which we can make our practice better. right? Currently, we are facing a lot of issues because of the lack of knowledge, because lack of confidence. And the whole objective of these sessions that we do is to improve your knowledge and also to make more confident pharmacist, that can build, right? So be more confident, be more enthusiastic, be more curious, because unless you are curious, you'll not learn, right? So staying curious is very, very important for all of us. Stay curious in whatever you are doing. If you want to learn oncology, stay curious in that. If you want to learn regulatory, stay curious in that. If you want to learn medical writing, stay curious in that. Build your network, very, very important. And all of these aspects, whatever we discuss, will be covered in the upcoming sessions. So you know how to build network, you know how to learn, connections on LinkedIn, you know how to make your resume, you know how to do group discussions, you know how to build confidence, you know how to do research. All of this will be part of the sessions, upcoming sessions. And Dr. Pravallika and I'll be there to help you out. We'll have other experts from different parts of the world also to be part of these sessions. And please continue your learning. So thank you so much, everyone, for your time. Thank you so much, Dr. Pravallika. We'll discuss again later on. And we'll ensure that all of the participants who are interested to learn with us with all the confidence they have. All right. Thank you so much. So I'll stop the YouTube live at this point of time. In case you have any questions, please do ask here on Zoom. And if you have any other questions, you please connect with us on LinkedIn and continue the conversation.